We know that also, like I said before, about half of patients progress still after first-line immunotherapy, unfortunately. So there is still room for improvement in that patient category for the development of novel treatment options. And with these results of the phase 3 trial, it still could play a role, but we think further research and discussing has to be done before we can decide where TIL fits in that category. And with regards to, for example, improvement of TIL, in this trial we used the most commonly applied protocol for TIL production. First of all, discovered and developed by Dr. Stephen Rosenberg. But of course, we have to look into, are there ways to shorten, for example, production time of TIL, look at side effects, etc. But that is still current research at this time.